KPIX5 reporter Mark Sayre shows us what's being done to combat this growing problem. Mark?
Well, Elizabeth, like so many public health problems, you make progress in one area and then a new problem area pops up. And so it is with drug abuse, with these new users often very hard to reach. In the mid-90s, heroin was one of San Francisco's deadliest drugs. It was a problem so bad that the city publicly funded an outreach program. The goal, to get a drug which reverses potentially deadly overdoses to those users who were at risk.
In San Francisco, there's been significant efforts to provide a lot of access to substance abuse treatment and also access to Narcan or naloxone, which is a drug that reverses overdoses and prevents people from dying.
And the results have been encouraging. In the mid-90s, San Francisco had about 160 heroin-related deaths. Last year, the number dropped to just 8.
So because that was so prevalent, so many people were involved in using heroin, the fact that we've made these reductions, I think, is pretty significant.
But now public health experts are facing a new problem. The number of prescription drug overdoses being seen in emergency rooms is on the rise, with the prescription painkiller oxycodone being the biggest problem. In 2004, Bay Area emergency rooms saw just 133 oxycodone overdose cases compared to 836 last year, a jump of 528%.
So people who receive prescription medications generally don't perceive that as them being a what you might call a drug user.
Dr. Philip Coffin is the director of substance use research at the health department.
If the person hasn't been using opioids, it doesn't do anything at all.
He says since the naloxone kits used to combat heroin work on other drugs, including oxycodone, new efforts are now being made to reach this latest generation of at-risk drug users.
Say patients that are on chronic opioids, they may not have a drug problem. Like I said, they may be using it exactly as prescribed, but that still is a dangerous drug. And so providing naloxone to them is a way to try to reduce the overdose deaths that we've seen.
Now, just today, a key assembly committee passed a bill out that's going to make it easier to distribute naloxone to those at-risk groups throughout California. Essentially, what it does is provide third-party liability, so perhaps a friend or a family member could actually administer that drug to somebody who would need it, somebody who's potentially overdosing, without any fear of liability. Elizabeth, that's just one effort they're making at the legislature to try to roll this drug out and make it more useful for many people who need it all over the state.
Sure. Well, Mark, why are outreach organizations having such a hard time helping these prescription drug abusers?
Yeah, part of the problem is just people admitting they have a problem. A lot of times these are occurring in suburban areas, or the initial prescription might have been given by a doctor or whatnot, and so they don't actually recognize that it's a problem, and then you try to give them an antidote drug, if you will, and they're very resistant to that if they don't believe they have a problem in the first place. It's a very vexing problem, but one that they're definitely working on.
Right, they think if they buy it at the pharmacy, then it should be okay.
Right, they don't see themselves, on a corner with a heroin needle in your arm. They view themselves as being different from what they think in their mind is a drug user.
All right, Mark Sayre, thank you.